Hi, good morning class. My name is Sarah Harris and I am currently a labor and delivery nurse here at J. Bear Hospital, and I'm also an MSN student at Liberty University, and today we're going to be discussing postpartum hemorrhage. So, just a few housekeeping items before we start. If anyone needs to use a restroom, you're going to exit out of this back door here and head down the hall. They are on your right. And just in case we have a fire drill or a real fire, you're also going to exit out this doorway, head down the same hallway, the only hallway, and it's going to be on your left, and we'll meet there in the Bear entrance area. I have saved time at the end for a few questions, if possible. If you feel the need to ask one during the lecture, that's fine too. Just raise your hand so I'm aware, and we can go from there. All right, so I want to discuss a very important issue with you today. It's the issue of postpartum hemorrhage. Okay, this is something that you will most definitely come across in the OB field. So first and foremost, this is an emergency, okay, and it needs treated as such. This topic itself is so vast, I could literally talk about it for a few days. However, today's lecture is going to be condensed into about 15 minutes, so I'm going to talk pretty fast, so just bear with me here. I want to kick stuff off with a short little video on YouTube here, okay? So what that means is I'm going to put inside a balloon inside your uterus, okay?
She was young. I think it was her third baby, and it was about 4 hours after delivery. And I noticed she kind of looked a little bit pale. She said, "Hey, I feel really nauseous," and that's all she got out. I mean, she totally lost consciousness, almost dropped the baby. So I pressed the call button, got another nurse in there, pulled back the covers, and she was actively bleeding copious amounts of blood.
Anyone decided to undertake the postpartum hemorrhage project because we saw the startling numbers of women who were dying after childbirth, and we wanted to save lives.
Activated a rapid response, got an ER doctor, ER nurse. You know, we had the postpartum kit was actually on the shelf in the room, so we've got that going. It was a great outcome. Couldn't have gone better, honestly. I just have to say, this is definitely, as a staff nurse, this is awesome to me. Postpartum.
All right, so what did you guys notice in that video? Yep, it was her third baby, so that's something significant to keep in mind. It said it happened 4 hours after delivery, so just think, you're working in labor and delivery, you know, you have just finished your recoveries, your initial recoveries, you transfer your patient from labor and delivery over to the postpartum unit, and 4 hours later you're thinking about lunch at this time, and this is when the emergency is going to happen. There was another key aspect in that video here. If you noticed, the nurse speaking, she called for help right away, and that is the number one most important thing that you can do when faced with an emergency like this. I want you to call for help because you just can't handle it alone. All right, so this slide here is just showing you the significance of the seriousness of postpartum hemorrhage, okay? When medical people fail to recognize that this is happening, they're also going to fail to provide early interventions. And then we're faced with the statistic that you see up there at top, that 2 to 3 women die every day in America from this complications of childbirth. And to me, that's just unacceptable. So we're going to go over ways that we can prevent this and treat this and go from there. All right, so the truth of the matter, there is no simple, clear definition for postpartum hemorrhage, okay? For those of us that have been around a while, you might remember it was the 500 cc's or mLs for a vaginal delivery and the 1,000 mLs for a C-section delivery. However, new guidelines have been established, and they're just saying the cumulative number is 1,000 mLs for any kind of delivery and or if your mother is symptomatic. So that is something to look out for also. Okay. Can anyone tell me how they would measure blood loss in a delivery? So, yep, you can weigh chucks. That's definitely a way. Visual assessment, that's another example. And then there's the drapes and canisters. So the main point I want to get across is that visual estimate is no longer acceptable. It is inaccurate, and we are not supposed to do it anymore, okay? So A1, our guiding resource here, recommends that all blood be measured. And for vaginal deliveries, you can do that with the under the buttocks drapes. And then, of course, if we're in the OR for a C-section, we can use our nice new Neptune suction machine, and that will be a way to formally measure the blood loss after delivery. All right, so there are certain risk factors that put a woman at risk for a postpartum hemorrhage to occur. If you remember, the video mentioned that it was her third baby, so multiple gestations, that will give you a clue that something might be happening. If you are doing a complete and accurate health history and admission physical when your mother comes in, then hopefully you will key in your head, some other significant items that might put your mother at risk for a postpartum hemorrhage. How often do we see that 36-week induction of labor that comes in, the provider's popping a Foley bulb, before you know it, it's been 2 to 3 days, she's been on Pitocin that long, so we have that prolonged second stage, and we have that prolonged Pitocin use, so those are also key risk factors there. And then, these are the signs and symptoms you're probably going to notice in your patient. As with any kind of blood loss, you're going to see the tachycardia, the hypotension. If you looked really closely in that video, it was a really fast screen, but it had that mom's vital signs over to the side. Her blood pressure was low, her heart rate was high. The nurse said she looked pale, couldn't get any words out. So those are all signs and symptoms that you're going to look out for. All right. So causes. The main cause that I want you to remember today to get the point across is uterine atony is the main cause of postpartum hemorrhage, okay? Atony just means that uterus is not contracting down enough. A stands for lack of tone. So there's many different reasons that the uterus could be doing that. It could have had multiple fetuses inside, or it could just be fatigued and not really willing to do the job that it's supposed to do anymore. Could be laceration. You need to find out where the bleeding's coming from. We'll discuss that more here in a bit. And of course, keep that bladder empty. There's also the uterine rupture. Every OB nurse's worst nightmare. We're hoping none of that happens. This slide, it just explains uterine atony a little further. So if you look at the top picture here, has that normal uterus, it's contracted down, it's controlling the bleeding, it's doing everything it's supposed to do. The bottom picture, it just displays, that floppy, boggy uterus that's having the atony, not controlling the bleeding, and the mom's going to have a hemorrhage. All right, so we want to prevent this from happening. So 3 key things that I want you to do to prevent this from happening. The first thing you're going to do is inspect. You're going to inspect mom. You're going to inspect everywhere, her vagina, her perineum, her anus. You're going to figure out where the blood is coming from and attempt to stop it. Along with inspecting mom, you also want to inspect the placenta too. So if the provider has it off to the table, you want to look at it, see if anything's missing, see if there's any tears, anything concerning, then you'll know what to do. Next is massage. We're going to be really aggressive with those funnel massages. So here at JBER, as you know, our protocol is every hour we're going to be doing that. Every 15 minutes for the first hour, and then every 30 minutes for the second hour, then every 4 hours, and so forth and so on. While you're doing that, teach your patient what you're doing so they don't think you're just torturing her. They actually understand why you're pressing on their belly so hard. Don't think they're trying to abuse them. And then last but not least, keep that bladder empty, okay? Kind of keep in the back of your mind when the last time was that your mom has used the restroom. And if it's been a while and she has no feeling, from the epidural, you We might want to do a straight cath or a Foley catheter to control that bleeding. All right, so the newest acronym in the labor and delivery world here is the active management of the third stage of labor. What this means is basically just 3 key things, okay? We're going to administer our Pitocin. We are going to do controlled cord traction. We are also going to do fundal massage after delivery of the placenta. So, Pitocin, that's just the key standard right now. Research has shown it just should be given to everyone. Just be really careful that you're getting consent from those mamas that don't want any medication, because we're so used to giving it all the time. Just make sure we're still informing them. Controlled cord traction, you know, that is mostly the provider when they're delivering. However, there are nurse-assisted deliveries that you may be a part of, so you need to remember to keep that nice. And then the fundal massage that we talked about, being aggressive in that. All right, so when prevention fails us, we got to move on to treatment, okay? So just like if you're in the ER, you have someone bleeding, you're going to do these initial things. You're going to do the vital signs. You're going to do the oxygen. You're going to do your IV fluids. Fundal assessment, you know, find out where the bleeding is coming from. Is she tore anywhere? Are there any lacerations that need repaired? Medications, we're going to get to that here in a second, that we're going to give. We might need to put in a device to control the bleeding. That's the picture of that tamponade device there. She might need to have surgery. Unfortunately, she might need a hysterectomy if we're not aggressive here. And last but not least, she might need a transfusion. You know, here in the hospital, OB does more transfusions than anyone else in the hospital. So be ready for that. All right, so here's our medications that we give for postpartum hemorrhage. We've talked about the Pitocin, that's the standard of care, Methergin, Hemabate, Cytotec, and then new to come here at JABER is going to be the TXA, and that will be another lecture for another day. We'll talk about that. It's coming soon. All right, I'm going to cover these medications pretty fast because I have allowed time after this lecture to go to the skills lab. We're going to draw them all up and discuss them in detail there. But the main thing we kind of talked about with the Pitocin, it is the standard of care to give after delivery. Make sure you're getting that mother's consent because we're so used to giving it here. Next is Methergin. The main thing I want you to know is that it's contraindicated in patients with hypertension. So us nurses, we all have funny ways of figuring out how to remember stuff. My personal way is that a person that is doing meth, the drug meth, wants to get high. So I'm not going to give Methergin to patients with high blood pressure. So that helps you remember it. Glad, happy to help. If you can find another way, please teach your fellow classmates here. Next is that Hemabate. So the important thing to remember here is that it's contraindicated in patients with asthma, okay? You're not going to want to give that. Cytotec, the main point here is that your mother is probably going to get a fever if you give her Cytotec, okay? That doesn't mean she has choreo infection, it just means it's a side effect from the medication. All right, so that was a really quick down and dirty briefing about postpartum hemorrhage. The key takeaways I want you to remember is that prevention is possible, okay? That statistic at the beginning is just unacceptable, you know, especially here in America. We have got to do what we can to reduce the number of women who die. It's just unacceptable. All right, does anyone have any questions before we move on to the skills lab? All right. Thank you for your time, and I look forward to talking with you later. Thank you.